Everyone, welcome to tonight's meeting of the Health and Social Care Scrutiny Review Group. Let's do the admin first. Could we do something about the feedback? Okay. Okay, is that better? Sounds better. Okay, tonight's meeting will be live streamed to the public, and a recording of the public part of the meeting will be available on the council's website in 24 hours. Any remote participants using Teams, can you use the hands up icon for questions and comments? Turn your camera and microphone on when speaking and off when finished. In the chamber, please, anyone wanting to speak, switch your microphone on and off when you have finished. Please switch off mobile phones or place on silent. Any apologies for absence?
Apologies from Councillor M. Hussain.
Okay, minutes of the meeting held on 21st of October 2025. Are those a true and fair record of the proceedings of that meeting? Okay, take that as a yes. Any urgent business?
None, Chair.
References from committees or other bodies?
None, Chair.
Okay, I just have one thing to talk about. I think that we usually have a standing item on primary care access. Due to circumstances beyond our control, we haven't had that report since August, September, and the next one's not due until January. So if anyone has any queries that they on primary care access that we'd like to put to the ICB, then if you could let us know, we will pass those on. Okay. Item number 7, Luton Safeguarding Adults Board Annual Reports 24-25.
Thank you. That's to me, Chair. So I'm Natalie Cowland. So I took over as the independent chair for the Safeguarding Adult Board in April of this year. So presenting the annual report for 24-25 to you this evening. So hopefully with the papers, and you'll have seen that the report has been published on the website. You've had an opportunity to look through it. So I'll just take you through the key findings. So you'll note that from 23-24, we had taken forward some priorities, 4 different priorities, because we identified that actually as a board we needed to focus our capacity and resources on a small number of topics. So those priorities were self-neglect and neglect of vulnerable adults, domestic abuse, modern slavery and sexual exploitation, and then lastly, emotional well-being and mental health. We also added within that report, the reporting year, rough sleeping to the priorities. That was following a ministerial letter that was sent to all safeguarding adults boards in 2024, setting out some requirements and requests for line of sight through to the Safeguarding Adults Board. We also had golden threads throughout the work streams, and I won't go through each of those at the moment, but just to give you an update in relation to each of the 4 priorities and progress in relation to those. So in terms of self-neglect and neglect, that continues to be a theme that is coming through from safeguarding adult reviews, and there was crossover between self-neglect and the golden thread that we had of mental capacity and making safeguarding personal. So we've made significant progress against that priority. So we developed and launched a self-neglect guidance pathway and toolkit, which has helped in terms of improving recognition and response to self-neglect. We've delivered a significant number of multi-agency workshops to in excess of 120 practitioners to build confidence in identifying self-neglect and neglect. And we have also embedded the CASPA, which is the Critical Adult Safeguarding Partnership Arrangements, which has enabled better coordination and safer outcomes for those who self-neglect or are being neglected. The learning from one of the reviews that we had, which was from Family T, supported identification of those needing carers assessments and promoted the implementation of whole family approaches as well. We do have some challenges that remain in terms of inconsistent recognition of self-neglect as a safeguarding issue and some delays in mental health assessment and multi-agency coordination. If we move on to the second priority, which is domestic abuse. So we had safeguarding adult reviews, and as well as those that are domestic homicide reviews, and also some regional and national learning. So we identified learning in relation to where domestic abuse exists in conjunction with drug and alcohol use. And the work that has been done in this area, we've seen increased safeguarding referrals and awareness, and improved understanding and use of initiatives such as Clare's Law, IDVA services, and stalking protection orders. We've also participated in targeted training and domestic abuse awareness campaigns, and included domestic abuse in some level 3 safeguarding training. So we've had increased and strengthened collaboration with the Domestic Abuse Luton Partnership Board and partners from the VCSE, so voluntary community and social enterprise sector. And as I said, we touched on improved data collection in relation to Section 42 inquiries around domestic abuse. In relation to modern slavery and sexual exploitation, again, we've identified evidence through safeguarding adult reviews and domestic homicide reviews and other audits around vulnerable adults suffering abuse or neglect through modern slavery and sexual exploitation, sometimes linked to earlier trauma. So we have developed a shared framework for identifying and responding to this, and also enhanced multi-agency coordination and data sharing. And we have evidenced an increase in the number of vulnerable adults at risk of sexual exploitation and with dual diagnosis who've been referred to CASPA. And we've also supported the increase in promotion of safe spaces and trauma-informed services, and delivered training in collaboration with VCSE partners and Azalea as well. So we do have some challenges that remain with in relation to the low number of safeguarding referrals in this area, and in embedding awareness and consistent use of safe spaces for people at risk of harm. And then lastly, in relation to our fourth priority, which is emotional wellbeing, mental health and suicide, again, through the reviews that we've conducted and audits, we've identified evidence of dual diagnosis, mental health, substance misuse, and suicide and diagnosis linked to earlier trauma. But we have achieved some positive work in this area as well, in terms of delivering trauma-informed care to over 4,000 staff across agencies, as well as the Oliver McGowan training, which is on neurodiversity. And we've reviewed the impact of SARS on practice in relation to suicide, trauma and experience of abuse, sexual exploitation and domestic abuse. Promoted suicide prevention strategies and tools, and strengthened strategic board membership so that we now have an advocacy provider, and promoted their role within SAR implementation and planning. We've also highlighted the need for cultural competence and consideration of intersectionality in safeguarding assessments. So we do have some challenges which remain in the development of trauma-informed services and consistent application of mental capacity assessments when required, and legal literacy in supporting decision making. In relation to the fifth area that we added in relation to following the ministerial letter around rough sleeping, we now have a designated name linked board member and a route of sight around rough sleeping through to the board. And we've also embedded and monitored the impact of learning of SARS involving rough sleeping and have a complex case pathway. So there are a number of cross-cutting achievements as well that we've achieved. So we've streamlined our subgroups and improved accountability in terms of delivery. And within that reporting period, we've published 2 SARs and conducted 3 thematic audits and produced 37-minute briefings, and also launched some new policy and procedures. We've also developed and continue to develop a multi-agency scorecard, because we identified that actually data is something that's really key for us, so that we have that multi-agency data to give us that sight and that visibility, so that actually we can understand what is happening and what is the picture of the issues and things that we need to be alive to in terms of safeguarding adults across Luton. We also, as I said and touched on, we've delivered blended training on a range of safeguarding topics, and have strengthened VCSE co-production and provider participation. We also had in this reporting period, so just prior to myself starting, a peer review of the board and the structure, and that's identified a number, 11 recommendations, which we're currently taking forward to strengthen the structure of the board and how we operate. So that is work in progress, but a number of those recommendations have been embedded already. So more recently, we have reset our priorities for 2026 to 2028. So that will start at the beginning of the financial year next year. And the 4 areas that we've identified as priorities for the board are transitional safeguarding, mental capacity assessments, domestic abuse, and multiple vulnerabilities, although that's just sort of an early working title. There's some work to be done for us to develop that further. And we also recognise that we need to strengthen the work that we do in terms of experts by experience. So we're looking at setting up a small task and finish group to support the work of the board, so that we can really bring that forward. And as I said, we have, in relation to the data, we've identified that is a key area that we need to continue to develop as well. So I obviously don't want to take you, it's quite a lengthy report, so I'd open it for questions from colleagues.
Thank you. Okay. Does anyone have any questions or comments? Councillor Arpet, then Councillor Isles.
Thank you, Chair. Thank you for the detailed report on this important topic. My question is, what measures are in place to improve community awareness of safeguarding?
Thank you. So I think in terms of the work that the board has done so far in terms of working and developing the co-production subgroup that currently exists, I think that's been quite important. So in terms of getting the VCSE community involved, so that actually, they are involved in the work of the board and are cited on it as well. So I think there is probably more that we can do, and we're hoping to do that in terms of raising awareness through some of the work that we want to do around lived experience and getting really targeted feedback and from people and service users as well. So, yeah.
Thank you. It's a follow-up question. How are children's safeguarding concerns being integrated with adult safeguarding?
So you'll probably be aware that within this reporting period, there was a decision to split the adults and children's boards so that they are separate partnerships and boards, which they always have been. But actually what we're looking to do within the new structure is to have a joint children's and adults partnership board meeting twice a year, so that actually we can really focus on those cross-cutting issues, because we know, that there are some things that come to the board that actually don't just touch on adults, they are touching on children. And also one of the things that we're keeping, because we recognise that it is a strength, is the joint case review group meeting, which is where we consider child safeguarding practice reviews and also safeguarding adult reviews. So that enables us to sort of have and to consider that cross-cutting learning, or where there are joint reviews in terms of whole families, so that we can sort of continue to build on that strength, because that is a strength. I think also when you look at going forwards, one of our priorities is going to be the transitional safeguarding, and that's a real clear recognition of the fact that, you know, we need to build those closer bridges between and, you know, work collaboratively across children's and adults, because, you know, that is a cliff edge that, you know, has been recognised not just here but sort of nationally as well. So actually, how do we make sure that it, you know, we can improve and strengthen in that area? And I know the Children's Partnership are currently going through a process at the moment of resetting their priorities, and in the event that transitional safeguarding is one that they select, you know, we would look at how we can work together on that in terms of developing that priority.
Thank you.
Thank you. Councillor Riles?
Thank you, Chair. Thank you for the report. I just wanted to ask a question about the board members and the training, obviously in all these different areas. How often is the training delivered so that they're fully up to date with changes and what impacts are taking place within the communities?
Okay, so in terms of specific training by agencies, I obviously can't answer that directly, but we do have in relation to the TRIEX, where we put updates in relation to changes in policies, guidance, and training that is available as well to the partnership, and obviously board anything that we consider that would be of particular relevance to colleagues in terms of ensuring that they're up to date or abreast of changes that are happening, would be considered at board as well, so that they are cited on that, or we would send out circulars. So we have a weekly messaging that goes out to from the Safeguarding Adult boards, which just gives details of updates that colleagues may want to be aware of as well.
Just ask another question, please. Regarding schools and colleges as well, that's another question about how much, you know, the training that they have and how is it embedded in their daily, when they have their like training days and things like that, because obviously we have rough sleepers, but we have students who may have family members who may be rough sleepers or with mental health issues.
Sure.
Drug issues. So I'm just concerned, and also with the mental health that leads sometimes to suicide. We know that there's a high level of suicide amongst males of a certain age as well. So how is this being like put into the colleges and the schools so that they are, you know, they can look for signs and they know what agencies to contact?
Okay, thank you. So that's no, thank you. So that's probably something I need to take away and come back to you on, if that's okay.
Thank you very much, Chef. If you could please, thank you.
I'm not sure if it would be helpful, but I'm the report author for the Local Safeguarding Adults Board, but I also wrote the annual report for the Safeguarding Children Partnership. So in relation to training, we have a large training offer. We have a platform called Safeguarding Bedfordshire Training, and there is about 300 e-learning courses available on that, which are entirely free. We have a wider training offer as well, some of which is delivered jointly, and we have some dates coming up in the next quarter. I think it's the 10th of December, we're delivering learning from reviews, which we're doing across adults and children. We also have a joint training day on the 12th of December, which is around domestic abuse safety planning. In relation to your specific questions about schools, obviously that sits under the Safeguarding Children Partnership remit, but they do have access to that. And we have a PANBED safeguarding education group that look at what the needs are for schools in terms of making sure they are alert to safeguarding training. And we also have on our strategic board for children named members who come from the various sectors of schools, including the further education sector, all the way through to early years and nurseries. So there is a huge offer. And obviously, if anybody wants any details about the safeguarding training that we offer, I can send a link because it's accessible to everybody. Our Safeguarding Bedford website covers both Luton Safeguarding Adults Board and Luton Safeguarding Children Partnership, has a wealth of information about these things. So if anybody wants that, I can send that.
Can I just ask another question? On the back of that, but are they like mandatory courses, mandatory training that they have to take, and that it's measured and that it's recorded that they've taken this training? Because you can have lots of courses, but if they're not mandatory, especially in specific areas, then it's courses you can offer and it'd be a choice. But obviously with these issues like domestic abuse, like suicide prevention and things like that, what we have to try and do, obviously, is as much as we can intervene to prevent as much as we can. So if they're aware of these trainings, which I think nowadays it's really important. So are there any mandatory courses that are out there that they have to take? Thank you.
There will be a range of mandatory courses that are monitored through the schools. There's a document called Keeping Children Safe in Education, and that includes everybody under the age of 18. I know we're here to talk about the Safeguarding Adults Board, but we do a lot of cross-cutting work. And within children's, we have what's called a Section 11 responsibility, where we ask partners and agencies to show how they've met those requirements. And for schools, there's a requirement under Section 157 and 175 of the Education Act, and we have an annual report on how well they've met them. And within that is evidence that they have achieved their safeguarding training requirements. So, but I think, you know, if you want more about it, that it's definitely worth asking some questions of the Safeguarding Children Partnership in that regard.
Can I just make a comment? But also the sort of schools I mentioned, colleges as well, because colleges, they deal with like plus 16, don't they, as well? So if you could come back to me on about the colleges as well. Please, thank you.
Sorry, Beverly, do you want to answer Councillor's question? Then I'll come to Pat.
So in terms of the colleges, they participate as well in the Section 11, even though that some of their pupils will be over 18. So obviously in terms of the safeguarding adults element, that is tested out through contacts and referrals that come in through the safeguarding routes. So I think it's something that will need to be taken away because obviously there's different requirements when it comes to safeguarding children to safeguarding adults, but certainly that's something we can take away and see what information we can provide to you.
Okay, thank you very much. Thank you.
Thank you.
And I've worked at both colleges in Luton, and I can say they both have safeguarding officers, and they both, all of the staff, whether it's teacher, teaching assistant, all the way through to management, all have safeguarding training. As the legislation comes in, they have it. I also sit on the safeguarding board, and most of the people in the room there are professionals that would actually, as part of their jobs, you know, in the police or hospital or schools, would also have safeguarding training there.
Okay, thank you. Does anyone else have any questions? Okay, I've got a couple of questions and some excuse me, some comments. I think you've already touched upon this. In the appendix, there's a section that talks about communication, the role that all people can play in providing support and advocacy to enable a person to disclose harm or abuse. Talking about moving from stakeholder engagement to co-production with those with lived experience of services. It's talking about making safeguarding practice person-centered. I mean, can you talk a little bit more about that?
Sure. So one of the things that we identified when following the peer review and when we looked at our structure again earlier this year was that actually we do have a really positive, and it's gone from strength to strength in terms of the VCSE subgroup of the board, but actually we haven't really truly moved to co-production and also having the voice of people with lived experience. So what our proposal is, and we're still sort of finalising it at the moment, is that we set up a time-limited task and finish group that will look at how we can bring people, experts by experience, people with lived experience into the work of the board, and actually really strengthen the work that we do in that area, because we recognise it's really important. We can do all of the work in the world in terms of changing policies, guidance, rolling out training, saying we're going to deliver in a particular area, but it's really important that we listen to people, and that those with the lived experience have the opportunity to contribute to that. So that's something that we're in the process of setting up at the moment, in time to sort of move forward with the new priorities.
Okay, thank you. My other question is about the key findings for the family T safeguarding adult review. So the last finding is systemic issues, including staff turnover, inadequate supervision, and poor quality assessments. So I guess that's an all-encompassing issue that probably is one of the causes of all the other issues in that review. Are those systemic issues, are they persistent issues that are happening all the time, or are they just issues that appear, or are they are the cause of something tragic such as happens in this case? If that makes
Bev,
sense.
Yeah, no, that does make sense. Bev, can I come to you on that one because you're closer to the detail?
Thank you. So the findings within Family T were based on what was found in that particular case. And if you read the Integrated Child Safeguarding Practice Review, Safeguarding Adults Review, it would be apparent where those failings were. And in this particular case, and that's why we've done so much work in self-neglect and neglect, there were systemic issues in how neglect for children, neglect of adults, self-neglect of adults was identified and how it was worked with. And in this case, there was considerable drift and delay. So as you would expect with any child safeguarding practice review SAR, there is going to be some work that needs to be done. So that's what's been addressed. And you can see the culmination of that's addressed in this annual report, because we had a detailed action plan to work on those recommendations and then to test out what the impact of those were. And it will continue to be tested. It's not something that we do and then we just go, well, we've done that, forget about it. We have an annual Learning from SARS Development Day to really test out what's been the impact of those changes, because there's no point making revisions to policy, procedures, training, etc., if you then don't test out how well it's being accessed. And I think if you look deeper into the report, for instance, our website, we had about 8,000 hits on the Safeguarding Adults Board page of that website, which actually exceeded for children. And we've never had that. So we know that we're getting the information to the front line, and it's then testing out further in the quality of referrals and assessments that are coming into the partnership. And that's part of the continued work that the performance scorecard and narratives will test out.
Okay, thank you. Has my question about whether it's I mean, these systemic issues, are those those system issues, do they just pertain to this particular case, or do you think that they're persistent across the board?
I think when you look at any system, you will find that it does relate to some cases, and you'll see that we undertook 3 audits during this year. And there was a bit of a mixed picture. There was some good practice identified, but there was also some practice that replicated what we found in that review. And that's why we continually stress test the system to see which aspects we're learning from, which bits we need to do more work on. But certainly in terms of where we were from the position we were in Family T, we are assured that actually our partners, they know how to refer, they know which cases require to be referred in. We produced a new guidance document, which is a Luton framework for adult safeguarding concerns, and that's really supported the type of referrals that's coming through. And you'll see in the adult social care data that's attached as an appendix that we are increasing knowledge from the system. So as I say, it's you will see gaps in any part of a system, but it's closing those gaps when you identify them and continue to stress test that system.
Thank you. Just have a couple of comments. I think it's good that continuous improvement and learning from experience is mentioned in the report. And as you answered a question from one of my colleagues, that there's an awareness of the risks involved in transitions. As I think on the committee, we appreciate all the hard work that's gone into producing the reports, and of course the work that the board's done over the past year, as evidenced in the report, including the production of the SARS, the training, the multi-agency audits, and the work of your screening performance task group. So thank you very much. Thank you. We're asked to note the report, so I think we can note the report. Okay, thank you. Okay, if we move on to item 8, the Domestic Abuse Strategic Plan 2026 to 2031. If you want to say who you are for the camera as you speak, thank you.
Okay. Thank you, Chair. I'm Councillor Maria Lovell, portfolio holder for Women, Equalities and Community Safety. Thank you.
I'm Megan Collum, a public health registrar within the public health team in the council.
Yeah. I'd like to provide a brief background to the strategy. Domestic abuse is a complex social issue that cannot be tackled by any single agency on its own. The strategy has been created over the last year and built upon partnership and collaboration between all statutory and specialist agencies working together with survivors and the wider community to address domestic abuse and achieve the best outcomes for Luton residents. Luton is setting out our strategic plan to address domestic abuse and aligning it with our Luton 2040 vision to become a healthy, fair and sustainable town where everyone can thrive and no one must live in poverty. Our strategic plan is based on priorities resulting from our statutory duties and the recommendations identified by a local needs assessment. The needs assessments synthesize local statistics, survivors' voices, feedback from frontline staff, policy, and best practice to identify 6 priority areas. Tackling domestic abuse is a priority for us here in Luton. where in 2024, an estimated 8,500 residents, or 1 in 20 adults, experienced domestic abuse. In the same period, 5,600 domestic abuse-related police incidents were reported in Luton. This is only a partial picture, as not all domestic abuse is reported to police, for many different reasons. This strategy also supports the government's pledge to halve the number of incidents of violence against women and girls over the next 10 years. There is no excuse for domestic abuse, and it's everyone's business. So until we all take our share of the responsibility for it and help change the attitudes that allow it to continue unchallenged, then domestic abuse and violence against women and girls will never stop. I invite my colleagues here this evening to join me in pledging zero tolerance for any form of domestic abuse to support our new strategy at this stage of this democratic process, without going for a formal public consultation as is expedient for it to be implemented. So thank you for listening, and I'll hand you over to Megan to take you through the presentation. Thank you.
Thank you, Councillor Lovell. I did have some slides. I don't know if we don't need them if they're, can't bring them up. If not, I can speak to the work. So just by way of briefly by background, the Domestic Abuse Act of 2021 places a statutory duty on councils to develop a strategy for tackling domestic abuse based on a needs assessment. And this is very much in the legislation focused around safe accommodation. But Luton, like many other councils, takes the opportunity to take a much broader view on how we can tackle domestic abuse. So the most recent strategy ran from 2021 to 2024. So we are currently out of strategy, very much due for review. And so my role was to come in and update the needs assessment, which, as Councillor Lovell has mentioned, included looking at our recent data, police, adult and children's social care, and local services, and some other data. We also spoke to stakeholders, so we talked to frontline staff, service leads, and we ran a survey for frontline staff. And we also engaged survivors through a series of focus groups and interviews through local services. And we used all of this information, brought this together to form the basis upon which we identified 6 key priorities, 5 key priorities, and then a 6th priority around partnership working, which will be in the papers. Briefly include priority 1, preventing abuse before it starts. Priority 2 is around intervening to stop escalation, early to stop escalation. Priority 3 around providing safe housing and support. Priority 4 around stopping perpetrators reoffending, and priority 5 around ensuring clear pathways to safety. In Luton, the local Domestic Abuse Partnership Board will be held accountable for implementing the strategy. This will be done via a joint action plan. There will be 5 work streams, 1 for each priority area. In each work stream will be chaired by 1 statutory and non-statutory partner. And these chairs plus a small working group will derive an action plan and implement that and be held accountable quarterly DALPB meetings and ultimately to the Community Safety Partnership. So we've brought this strategy here to this board, recommending that you support the strategy and allow it to proceed through to the next stage of the democratic review process. Thank you.
Thank you. I think as a committee, we can commit to zero tolerance of domestic abuse in all its forms. So yeah, thank you for the report. Are there any questions? Councillor Ahmed.
Thank you, Chair. How will the new strategy ensure early intervention reaches the highest risk wards, and how will impact be measured?
Sorry. Yeah, so that's a great question. So as you saw, our second priority is really completely focused around that early intervention, and that includes a couple of different aspects. One of those is around training of our professionals across the board to do routine inquiry and to identify signs of domestic abuse at an early stage before it escalates. We're also planning to work very closely with the family hubs and the Family First Pathfinder program in order to integrate and ideally co-locate services so that our domestic abuse specialist services are right there and able to provide support in a community sort of base and low threshold setting. The strategy also recommends doing outreach work in hotspot wards, which are those identified from the data that we have where we have high rates of offending and domestic abuse incidents. And so we can very much track and follow that data and adjust our response. So for example, at the moment, there is a hotspot in Marsh Farm. And so there is weekly clinics being held for the past few months on a Thursday, which has a number of different services, Luton All Women's Center, Stepping Stones, DART, the housing support team, who can come into that setting for people to come and access those services if they need them. So taking the services to where people are. I think that kind of encompasses some of the key aspects of our early intervention work.
Thank you. Another question is, what is the plan if national funding for safeguarding accommodation is reduced after 25-26?
Yeah, so that's a financial risk that I think we hold at all times because we can never look ahead fully to understand exactly where the budget allocation is going to go. We have been quite assured in recent years that that budget actually has been increased. We also know that the government has committed to having violence against women and girls over the next decade. And so we expect that there will be investment continuing for that, if not more. And so, yes, it's something that we will continue to keep an eye on. I think there's also some work ongoing as well to look at how we invest in prevention work and where that funding is coming from. So.
Councillor Moore?
Just to kind of follow up on that, you talked obviously there about how the funding over the previous period has increased. Is that in line with inflation or above? Because obviously if money's increasing, it's only increasing if it's getting you more for your money, so to speak.
That is a great question. I'm not actually sure if it financial, mathematically, if it is in line with inflation. I could come back to you on that specific. I do think that based on conversations that were had at the time, it was above inflation because it was more than was expected, as it were. But I can come back and confirm that. Yeah.
Sorry. Thank you. Thank you for the report. Thank you, Chair. Can I just ask priority 1, prevent abuse before it starts? Can I just ask just how is it, obviously it's excellent, teaching the children and young people how to recognize and form healthy relationships because that forms our society. But how's it been implemented? Please, thank you. Or has it started? Yeah, you're going to start.
Yes. So in terms of that prevention priority, a big piece of that is work within schools, and we do hope to expand that as much as we can to all educational settings. Everything that we would like to have covered within that curriculum we identified through the needs assessment is actually part of our updated RSHE curriculum for 2026. And a guidance has recently been produced on how schools can meet that. So our role is really in the public health team and across the council is supporting schools to be able to actually deliver that per the guidance and make sure that they're aware of that. There is some work ongoing now to speak with individual schools and audit the curriculum and identify gaps. That's being done by looking at the curriculums, but also by speaking to head teachers and seeing what can be done, where are the gaps, and where they need support from us to enable that, to enact that.
Oh. Yeah, just to add that there's a recent campaign on Raised Red, Fly Green campaign on domestic abuse, which was all over Luton, and targeting our young people as well. Because from a national survey, about 40% of young people didn't even know they were in abusive relationships. So it's raising the red and making them aware of the green flags, for healthy relationships amongst young people. So, which is also very, important, catching, it before it starts. Yeah.
Okay, thank you very much. Thank you.
So, yeah, can I just follow up on that? Because, I mean, some of those statistics that were quoted seem to be quite disturbing, that the percentage of young people who aren't aware that certain behaviours are abusive, and it is quite important to tackle those beliefs. So, don't know if you'd like to comment on that.
Yeah, so we are also sort of startled by the findings, particularly from the SHOE survey, which is a survey of secondary school age children from last year. It was some of the key findings for that is that over half of students did not realize that checking each other's phones was a harmful sign of a relationship. About 1 in 4 boys did not realize that did not recognize that pushing and hitting was a sign of a harmful behavior in a relationship. And across the board, we saw lower recognition of harmful and toxic behaviors among boys compared to girls. And so I think one thing we found when we were doing our assessment and speaking to people, we went and spoke to teenagers at Taco Youth Space, for example. And what really came out is the role of social media in sort of furthering negative attitudes, misogynistic attitudes, giving people misunderstandings of what a healthy relationship would look like. So I think that's a very big part of what thing we need to do is kind of countering some of not just what people are hearing about in schools, but outside of schools as well. And that's where I think where Maria has brought in awareness campaigning, both targeted and broad, is going to be really important in that, so that we are able to bring to the forefront of people's minds what a red flag would look like, what a negative behavior, but also bring that green flag in to show them what a positive behavior looks like and replace those attitudes.
Yeah, that's interesting. The green flags having that positive reinforcement. Presumably that does work, does it?
Yeah. It's all in very simple, language that young people can identify. Because some of the, he calls me all the time because he loves me. Something, as simple, as that can have, totally different meaning in terms of, domestic abuse or coercive controlling. So yeah, just bringing it all to the fore in very simple, language that, people, can identify to and make them think and thinking, oh, okay, I didn't know that was a red flag. So that's really good. And we're looking to go on a road show as well, when the strategy is launched next year. So, we'll be coming all over Luton and working with our members, to counsel. So if you want to invite us, we're happy to come down with the team as well. So not just looking at the hotspots, but, every area, we want to have our hands all over Luton. Thank you.
Okay, thank you. Councillor Moore?
I was just going through your slides for it's just a data point, because obviously you mentioned there's a line there that obviously talks about 75% of incidents not being reported to police. Is that a national statistic or a local one?
Yeah, that's derived from national statistics. We can sort of try and estimate that. We think it's probably similar here in Luton. But yeah, that comes from data from the Office of National Statistics surveys.
I mean, I presume you wouldn't know how they come to that estimation, because obviously if it's not reported, it feels about like as horrifying as that stat is, but I had no idea how they would come to that estimation.
I mean, yeah, I can help answer that. So basically what they've done is they've done a sort of a nationally representative survey where they've surveyed people. It's from the Crime Survey for England and Wales. So it's not just about domestic abuse, it's a lot range of different topics. But within that, they ask people if they've ever experienced any of these behaviors. Now, they don't ask them, didn't the domestic abuse, because people may not be self-aware of that. So if they've asked them all these different behaviors, and then they can say, okay, you've experienced domestic abuse. And then in what time, in the past year or ever. And then they can look at that and then look at the police data and see how many of that's actually reported.
Okay, is anyone else got any questions? I've got a few questions and comments. So talking about priority one, if you do get pushback when challenging cultural norms, how would you deal with that?
Yeah, so I think it was important for us in this strategy to address that head on in a way, to say that we do need to deal with cultural norms, because Luton is such a diverse town, has so many different communities, that actually there are so many different backgrounds and intergenerational issues and normal behaviors and things. I think we did need to use the strategy to dedicate some time to look at that. At the work of how we're going to be tackling that, of course, will be taken forward by the work stream leads. I can't definitely say how that's going to happen, but so far the early conversations were definitely with setting up some sort of like interfaith or diversity panel, or working very closely with like the Lutheran Council of Faiths and many other of our community groups, building trust and building some relationships there to then work together with them to see how best we can start to make inroads in those different pockets and different groups. Really, again, focusing on positive relationships and the positive things, and making sure that all our communities are kind of championing positive relationships, healthy relationships. Yeah.
No, I was just
Sorry.
going to say that these are difficult, conversations, very sensitive, to be had, but we need to have them, because, we want to eradicate domestic abuse, in our town. So, as sensitive as they are, and, with the good relationships that we have with our communities, which we do, with the mosque and the churches, because there's very hidden, abuse, as well, that we are aware of. But it's finding a positive approach, agree to disagree, and encourage healthy relationships and have those difficult conversations, which need to be had.
Thank you. Talking about yes, so we've just been talking about talking to community groups, faith groups, etc. What about communicating with that group of people who aren't necessarily part of a faith group or a community group? How do we get in touch? How do we communicate with those people?
So, I mean, that it is not straightforward. Those are the underserved groups that we need to find. I think our approach for that mainly is through outreach work and trying to go where people are, and whether that's, at the Luton Point, at the mall, at Sainsbury's, where we are, and going to have these conversations, going to community centers and embedding our services there where people are. It's also having widespread sort of these awareness campaigns that are there and visible for everybody to see. If we can't have one-to-one conversations, we're making it very clear that Luton, as a town, recognizes domestic abuse, has no tolerance, and wants healthy relationships. So through all sorts of different media, through different media channels, trying to make that as highly visible as possible. Do you know if you want to go?
Okay. It's all trust as well, building the trust within, our partnerships, and our communities as well. Because domestic abuse, I mean, it's very, very sensitive. And people, would like to, trust to be able, to even talk about it, as sensitive as it may be. So yeah, we building trust relationships as well with our communities, that people, communities who are, we don't want to say hidden or hard to reach, but, they will feel confident, to be able, to speak, doing our outreach work is very important.
Okay, thank you. So a lot of the, some of the objective and targets for the priorities are measured qualitatively rather than quantitatively. I mean, does that mean that there's a risk that it might be difficult to gauge the success of what you're doing?
I think it's really important that we get both qualitative and quantitative comment measures in there to sort of really understand how things are working. So I think if we just follow numbers, and I'm a big fan of numbers, but if we just follow that, we don't really get a full understanding of how people feel, how satisfied people are with services, how embedded things are and work, how they're working. So that's a bit of a, I'm not sure if you have any specific outcomes that you were looking at, but generally I think we tried to design outcome measures sort of in a very holistic way, make sure that we're covering all of our bases and measuring things in multiple different ways to try and understand how we're doing. So that was intentional, yeah.
No, that makes sense. Thank you. So I think it's mentioned in the legal implication sections that Section 57 of the Domestic Abuse Act confers responsibility to regularly review the domestic abuse strategy. Presumably that's that sort of continuous review and assessment is going to take place.
So one thing that I didn't mention is that alongside the new strategy, the public health team, which holds the strategic portfolio for domestic abuse, is reviewing our governance and strategic approach. And so looking at things like how frequently do we review our work, provide reports, who do we provide reports to, looking at the governance around the communication routes from the terms of reference for the Domestic Abuse Local Partnership Board, but also how that feeds into the Community Safety Partnership. So that's all being reviewed. The current proposal is that there will be an annual review of progress and a report that's produced. And it will be at that annual review that we'll take stock of progress and we'll sort of review whether or not we'll look at the sort of plan going forward and whether we need to make any changes or tweaks given the wider environment or given the local situation in Luton to our strategy.
Okay, thank you. So I think this is a comment rather than a question. So there's an interesting comment in the community safety implication sections about the strategy contributing to the design of the built environment, and that's expanded on the cross-cutting principle of inclusivity. So it talks about creating safe, culturally competent spaces. I think that's an important point in tackling abuse and in a wider sense that everyone should feel safe at every point of their daily lives. And the design of the built environment has a lot to contribute towards this. So I think that's quite important. No one else has any questions or okay. So yeah, I think we can support the strategy. It seems to be well thought out, comprehensive. The priorities clearly articulated with appropriate targets and measures. I guess there are risks to the strategy. So I guess the same ones that we do have now, like lack of capacity, finding the balance between high risk and medium risk cases, and as we've been speaking about, the lack of awareness within communities that domestic abuse is a problem. But I think those risks are recognised. So yeah, we can support the strategy. Yeah. Okay. Thank you.
Yeah. Thank you, Chair.
Item 9, Annual Public Health Report 2024.
Good evening. Thank you very much for inviting me today to talk about the annual public health report. It is dated 2024. I'm sitting here. My name is Elizabeth Elliott. As many of you will know, I am not the Director of Public Health, but I was the Director of Public Health along with Nicola Ainsworth from January to August this year. So this is our report that followed on from, which was started by our previous DPH, which was Sally Cartwright. So you've really got a three-person Directors of Public Health report today. So this is our independent report that is put together, led by us, and independent of what wider strategies, but it's what we decide we wanted to talk to you about and to bring to your attention today. We want to talk about the fact that we are a health equity town. I'm sure you are aware that since 2022, Luton was previously known as a Marmot town, now known as Health Equity Town, just for ease of understanding for all our range of stakeholders. I don't have a presentation and I'm not going to talk for very long, but I just wanted to give a summary of this report and just present it to you today. So the real key here is that the health inequity that is faced by our population in Luton, we are focusing on place, so how that links to where people live and how that links to around deprivation and around those wider determinants of health around housing, education, employment, as well as some health behaviours and how that has an impact and outcomes around people's health. We know that there is a gender difference as well. So we know that men live less long lives than women, but women live much longer lives in worse health. So we need to pick up that inequity. But again, across the town, we know that there's about 9 years difference in health and in life expectancy between both the richest and the poorest parts of the town. And that's where the focus of this work has to come. So we have been, as I say, doing this work for a number of years now. And this is not just a project that has a number of pieces of work attached to it. This is a system and a way of working. So as much as we do have indicators, because we need to understand how well we are achieving our outcomes, and we have a list of about, I think, 20 different indicators that we look at to ensure that we are addressing health equity. What we also know is that this is not going to be done by just looking at individual indicators. This is done as we work together in a systematic way, both in the council and both wide and wider. So the NHS, our anchor organisations, universities, our employers have a key role to play, primary care, secondary care, and there is on page 6, we have really a little diagram of all the different parts of the sector. The voluntary and community sector and the private sector are all the people who need to come together to work to ensure that this health equity town is going to deliver on its outcomes in the longer term. There is quite a lot of data here, so I'm really happy if there are any specific questions. I'm not going to go into too much detail on the data, but just to draw your attention to, and I'm sure you are aware that we have worse health outcomes in our wards where we have higher deprivation. That is generally found across not necessarily every single indicator, but a majority of our indicators, we are seeing worse health in people living in those poor areas. So in order to address that, we want to focus our work at a neighbourhood or a ward level. And what we've talked about in this report is some examples of pieces of work where we work really closely with our communities at a neighbourhood level to be able to deliver a range of different services and support that address health equity and those outcomes at that level. So I can talk about smoking, how we know that we have higher smoking rates in areas of higher deprivation, our adult obesity, particularly, although childhood obesity as well, but adult obesity is much stronger relationship between poverty. And then, as I say, a range of different projects. This isn't everything that we do. This is a real snapshot and really just to highlight to you that this is around all our partners working together. So we're proud really to present this as a really good example of our partnership working, of our engagement and commitment to addressing those underlying health equity issues. So any questions or anything you want to add? Thank you.
Thank you. Questions? Okay. I think, sorry, Councillor Ahmed, go ahead.
Thank you, Chair. What immediate action will the council take next year to reduce the 9-year life expectancy gap between our most and least deprived wards?
So thank you. You've probably picked probably the most complex indicator that there is in this piece, because that is the one that is really the bringing together the system approach, because what we're going to find is that all those health behaviours, all those outcomes are going to impact on health, on life expectancy and healthy life expectancy. So this is, as again, I think, just to really not necessarily not answer your question, but just bring it back to this work, which is it is all around all those pieces of work, not just one specific piece of work. But I think identifying those areas where we can have the biggest impact is where we've brought together our dashboard, and we have now an interactive dashboard. I think it is available online to be able to look at where those gaps are largest and where we can have the biggest impact, and that will then hopefully work towards addressing those life expectancy gaps.
Thank you. How will the council ensure that all departments, not just public health, embed the building blocks of health in their planning and commissioning to see?
Thank you. So yes, that is one of the piece of work, which is around how we talk about health and how we embed the language. Because what we know is, it's very easy to talk about health equity, but when we really want people to understand what's important, that it's not just around, eating healthy food and physical activity. It's actually around your housing, it's your environment, it's your education, it's your opportunities. We've actually engaged with an organisation called Frameworks, and it's in this document, who have done training within the council, but actually outside. And we talked about our system partners, and we've had over 50 system partners now trained in how to talk about those building blocks of health. So having a real positive approach to talking about health, rather than just saying, oh, it's bad housing, is actually a real positive approach, and helping people understand the kinds of things that not just they need to do, but around their environment and what's important.
Councillor Ross.
Thank you. Thank you for the report. Obviously, the health inequalities is quite disturbing, quite worrying, and the poverty levels, especially in certain wards, and I'm a councillor for one of the wards, the South Ward, so I see the poverty and the deprivation. I just want to understand how much is the engagement with the surgeries as well? The doctor's surgery, sorry.
Absolutely, and primary care and our PCNs are a key partner in this. And actually, again, if you look at the example of the Phoenix PCN and the Peace Hub are a real shining light of how primary care works with the voluntary sector, with the council. So and the faith sector as well. So they offer service. They don't just offer health services, they offer that full range around social isolation, adult social care, supporting people with housing, with financial issues. So it's bringing together all of those issues in one place. So as I say, this particular PCN are a real kind of shining example, but all our PCNs are doing different pieces of work around health inequality and equity, and they're all committed to that. But again, there's some are more developed than others.
I'll just ask another question. On the back of that, how is it going to be monitored? Because I'd like to see some figures of how much they're reaching and what the impact is in the areas. Please, you might not be able to give me that today, but I would like to see some figures.
Absolutely. I mean, the Peace Hub in particular, I'm sure we can get some figures about the work that they're doing, whether it's going to be really, this number, these are the outcomes, because as we say, it's really complex, so it's really difficult sometimes to see those outcomes, but they can absolutely talk about the number of people they've engaged with, and I can take that away and try and get some of those figures and report them back.
And sorry, also, I think testimonials are really good as well, because that actually, it's real people then. It's not just somebody saying, oh yeah, they've done this and that. So maybe some testimonials in there as well from the different areas, to see their stages from where they found them to where they may have risen or they may have overcome a problem. I think that's what I would like to see as well, please.
100%. I couldn't agree with you more. And actually, when talking earlier about qualitative versus quantitative, I think that sometimes that qualitative is actually really powerful, and those individual stories are really meaningful. So I'm happy, and I know I've certainly seen some from that particular project, but even from other projects as well. So I'm happy to find some of those and send them back to the group.
Thank you very much. Thank you.
Thank you. I've got a couple of questions. You're talking about system partners. So, I mean, who does that include? Presumably, all the various departments in the council, and does that include, say, for example, employers within the town?
Absolutely. So we have 3 working groups that cover all the 6 areas of the program, all the priority areas. One of them is focusing on employability and skills, and we work with the Inclusive Economy Directorate. So we're working with the Best Step Forward Luton piece of work and engaging with employers, and really key around adult learning, but also engaging with employers to be part of this program. So part of that working group, we will engage with those with employers, but again, anchor institutions, private sector, public sector employers as well.
Okay. So the recommendation number 4 is that we note the identified areas for further system development and next step priorities for 2025. Is that so? Looking at the report, is that so? Is that linked into the Marmot policy areas and the health equity indicators? I'm not sure when I was looking through the report whether I could find details about the next steps, or have I missed something?
Sorry, so on the last page, we do talk about what we are going to be doing with the data that we've developed over the last year. So I think the key aspect that we've developed this year is the dashboard. So that has allowed us to have access to that data. So now that we can see that at a ward level, that's helped us to target and identify those areas that we need to work with, and understand that data a little bit more. But did you have a more? Have I answered your question?
Was I looking for something a bit more detailed? I mean, so for example, you say expand the number of health equity indicators included in the dashboard. I mean, do you know which ones you're going to include?
So that's going to depend on our access to the data. So absolutely, we are working on that. Not all data is available at ward level, so we are looking at that. I suppose what this isn't is the Marmot report. This is the Director of the Public Health report. So I suppose it's just a slight differential in what we would kind of provide that level of data. In an annual report around Marmot Town, we would be able to kind of give probably a lot more of the data, but really happy to continue to look to identify those different those areas of the dashboard. We want to develop them across each of those 8 areas. So that's going to be our focus. So I think we have been challenged to look more at the employability and the job seeking community, like looking at those rates around people seeking work. So we're going to focus on that one next.
How do you prioritize the upcoming work?
Around Marmot Town?
Around Marmot Town, around the the next steps?
Well, this is down to all the different streams of each Marmot has its own program and its own program of work. So they have their own action plans and their own priority areas. So they will pick up on those areas that are particularly where we can have impact. So where the issues are and where we can have the greatest impact.
Is there the capacity to do all of the work?
There's never capacity to do all of the work, but it's about prioritisation, and we're going through that process at the moment of identifying our priority areas about where we're going to focus, for the next, 1 to 3 years.
Okay, thank you. If anyone else has any, Councillor Ambia.
Thank you, Chair. Yes, so thank you for the report. I just wanted to ask a question about. Sorry, this we have recently seen ICB has restructured. So what sort of challenge you are going to face to work with the new ICB in order to deliver the all these challenges what we are facing? Number 1. Number 2, I'm just will continue with the question. Then you mentioned on the point number 8 about Marmot. Sorry, point number 9 about Marmot principle. So child-friendly town. So it's to me for children well-being is not only for the medication. The well-being depends on the like all the facilities about outdoor activities and other things. And we have seen. I personally have experienced the thing is that council, especially the playing equipment or outdoor facilities inadequate or they are not maintained, and it's been because of the budget issues. So how are you going in order to achieve these things? This is the well-being, mental health. This is also another important. So how are you going to um, tackle or solve these issues, or finding the lobby to get this to deliver in order to achieve your target? And also another thing is what I mentioned previously about ICB restructuring, because some other borough or other town above it's a mandatory for the above 40 they do health checkup, but in Luton we didn't see the mandatory health checkup for the general public, especially Asian people where there is a high diabetes, cholesterol, and heart attack. This is I can share my personal experience. I asked GP about 40, then when I will get a routine checkup, they say they don't have any plan. But where there's some other town, they do routine mandatory checkup people who have above 40s. So this sort of thing, how are you going to achieve and how are you going to collaborate with ICB to deliver? And also last thing, you mentioned few PCN, they are active phonics. Is there any way you can like engage other PCN network to do the regular activities, especially patient participants group to engage or at least once in a week open day session for diabetes checkup or anything? Because I know the health feast is successful event, but it is like, is there anything you can do local wise, decentralized, where each PCN can accommodate at least half day in a week to engage people to do all this checkup, where people who are unable to book an appointment to the telephone call, etc. Thank you. Sorry to ask so many.
You've raised a lot of issues here, and I'm not going to be able to answer all of those. And obviously, I'm here today to talk about the report, and this covers some of what we do in public health. But everything that you've raised is part of what the public health team is either responsible for or engaged with or a stakeholder in. I share your concerns about the changes in the ICB. This was like that happened very suddenly. And over the last 6 months, there's been a significant change. We are waiting to see what the new. So it's Central East is the new ICB. Obviously, I'm sure as you know, it covers BLMK, Hertfordshire, Cambridgeshire, and Peterborough. So it's a much bigger patch. So we are aware that that things may well be different, but we are assured that our PCNs still continue to deliver healthcare, our primary care, our secondary care are still funded, are still delivering. And although people might be working over a larger footprint, we continue to engage with and work closely with the ICB, and we spend many of our meetings and lots of what we do is about engaging and working with them in partnership. So yeah, it is a period of change and it is going to be difficult, but we do need to wait and see what those outcomes are like. But as yet, it shouldn't change delivery. I think that's what's really key. It's about the management and that wider overarching piece rather than delivery. You pick up a lot of questions around children's services. My portfolio is around children and child-friendly town. Absolutely, there's lots of things that you've picked up there that we work together with children and families team. We work with the SEND team when you pick up around play areas. I'm part of the physical activity strategy as well, which aims to ensure that children, families and adults have access to physical activity, to green spaces, to play areas. And that's part of what we do. Again, might not be focused in this report as such, but again, all this work, and when I talk about health equity town being a system, this is how it all works as a system. So this isn't everything that we do. This was just a snapshot. So yeah, a range of different work around children's lives, making their lives better, working with our mental health providers, working in schools to look at the work that they do. So I know I haven't picked up on all those ones that you raised, but just to, we can always come back and talk about those different pieces. And we have Children's Scrutiny tomorrow where we talk about a lot of those issues. Health checks, again, we are responsible for, and we commission health check programs. So it's for people within certain age ranges and without certain medical conditions. But we're also really pleased that our provider Total Wellbeing are now really reaching out. So we have we have a portable health check units who are in different places across the borough. People can go and do their own health checks. In the point themselves, there's now Total Wellbeing have a pop-up, so any people can just drop in and talk about a wide range. They could talk about blood pressure, diabetes, stopping smoking. So we are continuing to reach out and do as much as we can to engage with the wider community around their health issues.
Oh, yes. Sorry. Councillor Amber, if you've got any queries or questions about
No.
ICB, then if you want to talk to me or talk to Democratic
Yes.
Services, we can pass those on to the
Thank you.
person.
Thank you.
Pat.
I just wanted to reply in relation to the PCNs. You know, they all hold health events across Luton. So like last Monday, Medics Health had an event at Chall End, and they had about 200 people go for diabetes checks, blood pressure checks, weights and all that. And all the PCNs in Luton hold events like that, maybe once a month for each PCN at different places across Luton. And sometimes people are targeted, like, I don't know, over 40, come and have a diabetes check. It's not people with diabetes, they're looking out for people with undiagnosed conditions. So that happens regularly. I would say we attend at least one a week to support them. So they happen all the time, but they're not happening at GP practices, they're happening out in the community.
And they're very effective ways, very efficient ways of picking up diabetes and other conditions. That's right, isn't it?
Yeah, they are. And lots of, it's sort of, the behaviour of people is changing. If you go back a couple of years, you might have had one of these events and hardly anybody attends. But I know at Chall End last week, they were queuing out the door to get in, you know. And a few weeks ago, I was at the Hatters one in Sundon Park, and it was the same thing, people queuing out the door to get in to get blood pressure checked and diabetes checked and stuff like that. So it's really happening.
Yep.
I would like to share one of my personal experience. One of these practice manager for the GP surgery practice manager approached me, like, you know, one of the event we met, and she mentioned about she said she's looking for some sort of private companies who can donate for their practices for those, you know, this one-stop diagnostic service. Like then they run out of equipment for diagnosis. Then I ask why not getting from this ICB. They say they because of the budget issue, they have a limited what they get from through the NHS for the per patient. So they don't have enough money to run those sort of outreach program. So they say they're looking for some private donation or something to buy the equipment for diabetes check, cholesterol check. So my question is there anything council can have some extra money to give some sort of incentive or sort of things for each GP surgery if they wanted to run any sort of health feast or any sort of one-stop diagnostics service like cholesterol, diabetes check, rapid point of care service. Is there anything council can think allocate some fund to the GP practice if they would like to, if they can access to buy those equipment to provide these services? Because this is, they say, I asked for the manager, why don't you get it from them through your NHS? They say they're complaining, even like whatever they get too low on the current market. So they say we can't ask for any any sort of equipment. So is there anything council can help to GP surgeries if they wanted to run those sort of event for?
Thanks for
you.
that. I mean, I think it might be, I think it's probably worth, just saying that we probably can't give us an answer in that sense today. But I think what's really clear is that we already, because we have they're called the CSU machines, and we put them in across the town. So they're not in GP surgeries, they're in community settings, they're in pharmacies, they're in libraries, they're at the depot. So we have committed, and we have put a significant amount of funding to commit to those machines, and they identify people with high blood pressure, overweight, people who want to give up smoking. We also support we commission the health check program. So we fund every GP to do those health checks. Now, if there is a particular reason why they can't do that, then they can they can discuss that with us. But it's not something we can kind of give additional funding for some diagnostic checks. So that those government mandated diagnostic checks that everyone between 40 and 74 is entitled to, we already pay for that, and that will comes out of our public health grant, and we already commission that. Whether we can give anything additional, again, we're all living in scarcity at the moment. It's not something that I can commit to today. But again, it depends on what those problems are. But unfortunately, it's not. We can't prop up the NHS over and above what we're already committed to.
Thank you. If there's nothing else, we're asked to note the points detailed on page 1. Won't read all of those out, but I think we can note those. Okay. Thank you very much. Thank you for the report. Go on to item 10, the draft work programme 2025-26. If anyone has any comments or questions about the forthcoming programme, we take that as it stands. Okay. In that case, that's the end of the meeting. Thank you very much, everyone, and have a good evening.